Wonderful. So it is my pleasure to welcome Sana Sultana, a cardiologist, a cardiothoracic and vascular surgery physician from known as a PA, and she is from Dominican University. Welcome, Sana, and thank you for your time.
Yeah, thank you so much for having me.
Wonderful. Just a few good housekeeping rules. Please stay on mute throughout the duration of this session. And if you have a question, please feel free to use the Q&A tab on the right side of your screen. And I do want to encourage all of you to stay with us till the end of the session. Please know that all the Job Spotlight interviews will be recorded so you can view them starting tomorrow. And thank you for your cooperation. I just want to share a few overview stats about the physician assistant, and I will be saying PA, short for physician assistant, just so you know. So the median wage in Illinois is over $125,000. There are approximately nearly 4,000 PAs in Illinois. And there are approximately annual openings of 364 here in Illinois. And there is a 10-year growth of 30.1% in our state. Physician assistants typically need a master's degree. Most applicants to PA programs already have a bachelor's degree and have some health-related work experience. And physician assistants see patients, they diagnose patients, and they also prescribe medications, all while working under the supervision of a doctor. And to tell us more about the role of the physician assistant, we are so fortunate to have Sana Sultana with us. And Sana, welcome once again. And I'd like to start off by just saying, what led you to become interested in a career in healthcare?
Yeah, absolutely. Thank you so much, Paulina, for having me. Originally, when I was growing up, I grew up in India until I was 15 years old. And at that time, where we were located, we didn't really have access to any medical necessities. We couldn't go to hospitals, so they were all further away. And the ones we did go to required a wait of 2-3 hours long just to get inside the door of the hospital. So at that time, I knew that I wanted to work in medicine and I wanted to make a change in my community. I just didn't know what I wanted to do. And then as I grew up, I went to college and I worked in a hospital. I realized there were so many things that were available to us. That you didn't just need to be a nurse or a doctor or a PA or respiratory. You could do so many roles in medicine and still care for patients and be there for them. I found out about this position when I was a patient care technician working at a hospital. I realized there were these providers that stuck around for hours and hours long, and I saw them conversating and hanging out with the patients a lot more than other team members could. And when I inquired, I found out that's what PEs do. And that was my biggest inspiration. I said, wow, I get to care for patients. I get to spend so much time with them. So that's how I got interested, and I pursued PE studies.
Thank you for that. Well, thank you so much for your service as a PA. I know that there is a shortage of healthcare providers in Illinois, so thank you for your service.
Yeah, absolutely. Thank you.
Can you share with us, Sana, what does a typical day or week at work look like for you?
Yeah, absolutely. First, I love my job and I can't wait to go back out there every single day. It sounds a little bit cliche, but it's really the truth. I'm very excited about starting my day. So every day I get to work in the morning, I would say maybe 6:30 a.m. I round, meaning I look at my list and I see all the patients I have in the hospital. Now it's going to look different for people who work in different setting. If you work in outpatient clinic setting, it's a different schedule. Versus me, I work inpatient in the hospital. So every morning I go, I see my patients, I see what needs to be taken care of. I assess them for that day, kind of make a plan like, okay, this is how today's going to look like for these patients. And say, this patient or these patients are looking good, I think I can discharge them home. So I make my list, go around, see people, see what's wrong with their labs or the diagnostic test we were looking for. So I kind of assess and treat patients. Once I'm done with that, usually we have procedures scheduled, surgeries in the morning or the afternoon. If a procedure is scheduled in the morning, say 7:30 a.m., I'm already finished rounding and seeing all my inpatient people before that. Once I finish the procedures, the surgeon leaves the room, I close the incision sites of the patient. Say if it's the open heart, then I close the chest. And the vein harvest for open heart, the conduit is taken from the leg. So I close the leg. I make sure the patient is stable. I take them to the ICU, drop the patient off in the ICU room, and then I get to go put my post-op orders in. And now once that's done, after my procedure, I return all the patient calls that I've gotten and I didn't get a chance to call back. I attend those and I prep for next morning, whoever's procedures next morning. So I make sure their labs are stable and they're all set to go. And once a week I have clinic, which is Thursdays. So I do all what I just said. Plus, I also see patients outside of the hospital. So I go there early in the morning, see those patients, then go back to the hospital. So that's usually how the day looks like. More or less, you'll probably be busy the whole day if you're in a hospital setting. So lunches are whenever you can squeeze lunches in the middle, you do it. Or if you know you're gonna have a long case, you eat early. Sometimes our cases are 7-8 hours long. Unfortunately, which is why there's no way to plan our days as a PA, at least until 7 p.m. I would say. After 7 p.m. you can kind of, because the on-call person will take charge. But that's usually my typical day.
Thank you for that. Sounds like very busy, but an important role that you play in the healthcare team. What would you say is the most rewarding part of your job, Sana?
My most rewarding part, I would say, is when patients are discharged from the hospital, that day of discharge, they are so thankful. And sometimes I think, wow, this patient had it rough. I wish I could make things better, because I'm critiquing myself. But then that patient will come around and say, wow, I've never got a service like this anywhere before. I mean, that to me is the ultimate um, reward that I could get. That I took care of someone and they're happy with how things turned out. Even if they say, they got bad prognosis, they have cancer that's inoperable, they're still so thankful that we help them get to that stage and diagnose their cancer. So I think that's a really big blessing, to be trusted and um, to feel like that patient can depend on me. For me, that's my biggest reward.
Thank you for that. And in your experience, can you share a little bit about what is the salary range in Chicago for a PA?
Yeah, absolutely. I would say that most surgical specialties what will start maybe at 105 K per year. If it's a non-surgical specialties, I can see them starting at 100K. But more or less, that's a new grad, zero experience right out the door. You just graduate P school, that will more or less be your salary, regardless of any specialty. Um, Once you are experienced, I would say 2 or 3 years, it's a big growth. 25K or 130K is usually what PAs do. PAs in my specialty, they earn as much as 160 to 180 per year. As opposed to patients, say if you are doing critical care, those guys can earn up to 140. And then if you do, say, like psychiatry, that's also very asked for a demandable specialty, they also earn, I would say, 150K. I mean, this is from my experience, from speaking to other PAs who are my friends from other specialties. It may not be true for this date or age at this time, but that's from my experience I've gotten from other PAs I've worked with.
Thank you. That's a nice salary to have.
Yeah.
What makes a good PA? Can you share what skills, interests, and abilities you need to possess in order to be a good PA and to also enjoy the job?
Yeah, absolutely. I think if you want to be a good PA, you have to learn to take any criticism, because every single day is going to be a critique and learning moment every single day, especially as a new PA. If you want to survive as a new PA, you cannot be hesitant in saying, well, I already know this. Even if you know something, if someone's teaching you and saying this is going to make you better, learn it. And there will be bad habits that people will teach you. You just have to know how to weed those bad habits out and say, you know what, this way is the right way. Even if it's a longer way, I'm just going to learn it that way. So a good PA needs to be amenable to changes at any time, especially if you work in surgical field like myself. You're in the OR and everyone's stressed at all times. Now, you can adapt and be stressed, or you can adapt and say, all right, I'm just going to take it light. I'm going to be very attentive and I'll do the right thing, but I'll keep my stress level a little bit low. So when someone says something to me, it won't trigger me. So a lot of I would say PA growth is dependent on communication. So say something happens at the OR, and you want to, OR is operating room. So during procedure, you say something happens and you didn't like the way it happened, mention it to the surgeon. Do it outside the OR, talk to them. I've done that in the past for myself. And I said, hey, I don't know how you're going to work with this, but I found this problem and I want to work it out. So communication is a big key. Constant growth and accepting criticism is very, very important in growth. Um, and then as far as what I do everyday basis would be, I diagnose, I treat, I order imaging, I do um, assess patients. I see them outside in the clinic, and I tell the surgeon myself, I'm like, you know what, hey surgeon so and so, I don't think this patient looks like operable, because look at all these comorbidities patients have. Look at just their clinical conditions. They're not going to withstand a surgery. So the surgeon really depends on my opinion. Sometimes they don't even see the patient, but if I've told them that, hey, the patient is not a good candidate, they actually take that into consideration. They always come see patients later because they're kind of busy doing in other hospitals. So you're basically the ears and eyes for your surgeon or your attending physician if it's a non-surgical specialty. So, and then inside the operating room, I am closing an incision. I stand on the opposite side of the head. So the surgeon is on the right side of the patient. I'm on the left side of the patient's chest, and we're doing the whole procedure, and we're doing it. So you're 100% involved in the surgery. So if you don't like surgical specialty, do not go into it, because you will be doing surgery the whole time. And you will be heavily involved. But if you love closing wounds and sutures, I think surgical specialty is a great place to go. And so is emergency room, because you're going to be doing a lot of suturing and assessing patients there as well. So that's my 2 cents.
Well, communication, initiative, and leadership as well are important skills for this role.
Very true.
Yes. Can you share, Sana, what makes your job challenging?
Yeah, absolutely. I would say because I'm always multitasking. I'm not multitasking at the same time. I'm just, for example, like today, I didn't have any surgeries, but I'm scheduling a case, right? And it's an endovascular aortic abdominal aneurysm repair. Now, for this case, because it's endovascular, I have to call the people who put the graft in. So that's a different company. I have to work with radiologists who will help us in the procedure. That's another surgeon. And the surgeon I work with regularly. So I have to call these 3 people, make sure they can get the same time they can work on this patient. I have to call the patient and make sure the patient's available. I have to call the operating room. So that's just one case. So you do this all the time. So you're speaking with all these people at all time while you're seeing your own patients and consults in the hospital, while you're also answering phone calls from patients. So you're doing a lot of things at the same time. Sometimes you may not reach your patients back until later. So sometimes, so you have to know how to prioritize. And if you don't know how to prioritize, it's a big struggle in surgical specialty. So for me, I would say just the amount of work we have, we if you don't learn how to prioritize, that can really create a little bit of trouble because you'll probably be here 9 p.m. You still won't be able to get through the whole thing. So you got to know, as a good PA, you should know, all right, this is what I can get today, and this is going to help my patients. Let's get this done today. And tomorrow's task, can I wait until tomorrow? Okay, if I can, then you work on it tomorrow and protect your own mental health and still be helpful to the patient. So you just, I would say, multitasking and prioritizing are difficult things uh, that are very difficult, and you won't know until you work in the field, and then you're like, oh, okay, now I see it. Before going to PA, before starting a job, when I was just in PA school, I said, how hard can it be? These people complain. Good God. When I started my job, and I said, wow, I need to go back and apologize to my friend. Because boy, I mean, so yeah, anyway, good life lessons here.
Yes. There's nothing like being in the profession and actually going through the real roles.
Exactly.
So what is the difference between becoming a physician assistant, and a nurse practitioner?
Good question. So a nurse practitioner and a PA basically do the same jobs. Um, how we get to doing the job is a different route. NPs have a little bit of a longer route. They do have to have masters and a couple more years of practice, or I would say not. It's not residency, but it's like residency that they have to do. They have a couple more years than we do, and they have a nursing model that they approach. PAs use a medical model, which is kind of a model that surgeons and doctors and other people use as well. So the way we approach medicine is just a little bit different. And the end of the day, we do basically same thing. But say, for example, if you're a nurse and you're saying, you know what, I want to go become a PA, or I want to be an NP, and I want to take care of my patients, diagnose and treat, then for a nurse, it would probably it would be a great route to become to do masters and become it's masters in RN, so MSN is what they call it. And then you go to NP school and you do a couple years of NP school and then become an NP. For PAs, if you have been working in the medical field for a little bit, all you need is some more experience. You get maybe 2 years of experience or 2-3 years of experience under your belt. You apply for PA school, you just do masters and you're done. And so it's a little bit of different approach. But now, if you look in all the operating room jobs, more or less PAs take those jobs. And then NPs, you'll see them in the hospital, inpatient rounding, meaning they'll be working with the people who are hospitalized. They'll be taking care of them. While they're doing that, the PAs are in the operating room working with the surgeons. So it's interesting. It's not that NPs will not ever be in the OR. No, there are some NPs who do like being in the OR, but I think with the way their model of medical learning is, they really enjoy working as an advanced care practitioner in the hospital setting instead of the operating room. So those are, I would say, kind of two branches of how you can still treat your patients and diagnose and treat, et cetera, without actually having to be a doctor. You can go these two routes and still kind of do the same thing, either way, in the end of the day.
Thank you. And I must say that I had not heard about a physician assistant until I had to take my kids to the doctor. And I thought I was dealing with a doctor, but it was actually a physician assistant. And that's when I first learned about that role. So can you share a little bit more about how the physician interacts with the entire healthcare team?
Yeah, like how a PA interacts with everyone around them.
Yes, well, the
I see.
entire healthcare team, because sometimes we see the doctor as being the only person in healthcare, but in reality, there is a healthcare team, right?
Yeah,
And
absolutely. Oh, that's a great question. So the way PAs work is they, as I was saying earlier, they are the eyes and ears of the doctor. Um, and they are really entrusted by, after interested by the doctor if they have worked and have a good relationship. And so I know how my surgeon works. So, and I know what he needs in patients, what he looks for. And I have my own little things that I look for in patients that I kind of need a check box before I say, all right, you can go home. And he has his own bits. So every morning, once I round, I see the patients. Before I even see the patients again with him, I'm already talking to the rest of the healthcare team. I sometimes the pharmacy calls me, hey, this medication, what do you think about this dosage? I'm like, all right. If I already know and I've used the drug over and over again, I'm confident. I let them know, hey, give this much every 8 hours for 24 hours. Then I go speak with the nurse taking care of the patient. Hey, tell me everything about this patient. These are the labs that were different. I want you to make these changes. Okay, next I go to, most of our patients are in ICU. So I go to ICU next, talk to the doctor of the ICU, kind of say, hey, this is my plan for today. Patient is looking good, or hey, patient is not looking that great. I want to keep them here for another day or two. Repeat labs and see how they're doing. And then finally, there are always more than one doctor on file. So apart from apart from my surgeon, the ICU doctor, there's also heart doctors, kidney doctors. There's sometimes brain doctors, also called neurologists. So there are all these specialties sometimes on a one same single patient. My job as a PA is to make sure everyone knows what's going on. So sometimes it's one patient, but I make 5 or 6 phone calls. I sometimes I can rely on my notes and say, I hope that these guys read my notes. But I don't do that. I just call them anyway. It's the best way. It's 5 minute call, whatever, you spend some 5 minutes, but you have made a direct communication with that doctor, and now they know their plan. Now, once then when my surgeon comes in, I let him know, hey, I spoke with everyone. Patient is good to go. Or sometimes it's hard to make a decision. Say someone's very, very ill. Those decisions, I call him before I make them. Like, hey, I think this patient needs a little bit higher amount of pressors. Or, hey, this patient's vitals are not looking that great. What do you suggest? Should we make a change? Or, hey, this urinary output is very, very low in this patient. So those things I then talk to my surgeon about, and I relay all of this information to the rest of the team. So it's PAs are very, very vital to medicine, and we just don't know because we're not exposed as patients. We're not exposed. We don't know who's taking care of us at all times. But PAs are such vital um, aspects of medicine, and they fill that gap that medical care really has at this time. And I hope they continue to do so in future too.
Thank you. No, definitely PAs are a vital team player in healthcare. So thank you for that.
Yeah, absolutely.
What are your future career goals? Do you want to stay in the same role you are in currently, or do you have plans to move on? And if you move on, what are you currently doing to pursue the next role?
Yeah, absolutely. Um, so right now I work for a very small community hospital. I would say down the line, I would like to work for a bigger hospital system because number one, I know that they're going to have adequate staff compared to my hospital. I mean, and I love my hospital, don't get me wrong, but I think that they are, in order for you to grow in life, you have to work for bigger systems and smaller systems. Because smaller systems, because you get exposed to everything. And you have to kind of think outside the box at sometimes because other PAs and my other like friends who are PAs, they don't have the same struggles that I do in my hospital. So I have to kind of think outside the box, figure out things on my own, a lot of asking and learning. So in other big hospital systems, everything is streamlined. So the patients are not really struggling to find, hey, I need to do imaging. How do I do that? Right now, I schedule everything. I'm kind of a receptionist and a PA and help with, I don't help with billing, but I answer whatever questions that they have. And then I also am in the hospital covering that part. I'm also getting to see patients before they even go to the, so I'm doing a lot of these roles that a lot of big hospital systems have people in place. So over the span of several years, it helps PAs be prevent being burned out of their profession. If you keep working, unfortunately, at this higher level of stress at all times, at one point you just want to quit and you want to do something else. So you just have to learn what your body can say okay to and how much you're like it's acceptable basically. And so for me, I would eventually like to work at a bigger hospital system where they have more capabilities of letting in more complex cases. I honestly love taking care of sick patients. It sounds crazy, but the reason I do is because they have a lot of complexities to their case, and you get to learn so much that you've never seen before. So I unfortunately will get to see that in big hospital systems where they have a lot of advanced technology and a state of the art equipment. And when you have that, there's so many cases that you can take, which my community hospital can't. And I unfortunately have to transfer some of these people out. But if I were for a bigger hospital system where they can kind of accommodate that, then I would be able to learn that bit too. So that's where I think my future is going to be. And specialty wise, I think more or less I'm going to stick with similar specialty. Still do heart and lung. Maybe not vascular, but definitely heart and lung.
Thank you. Sana, if someone thinks they might be interested in becoming a PA, but they're not quite sure yet, what could they do to learn more about this role in healthcare?
Yeah, I would say best thing would be in a hospital, shadow a PA. That's the best way. And a lot of places allow shadowing. Where I went was, I would say, I went to North Shore in Evanston. I used to work there in the past too, so that's how I found out that there's a shadowing program, and you can shadow a PA for a couple hours. Just know what their day to day looks like, so you can ask every question you want and see them in action. So I mean, I feel like if I don't know where I'm going, but I'm inclined towards being a PA, I would definitely suggest shadowing a PA. You could also shadow a doctor because you'll pretty much be doing the same thing as a doctor anyway. So you'll know that, all right, well, this is what my future, if this is my future is what it looks like, then all right, if you like it, then that's something you can pursue. But if you're not interested or you're like, wow, I do not want to deal with any of this, then I would say then you want to slow down and see what other roles. And there's so many roles in medicine, so don't give up on medicine. But definitely suggest shadowing a PA, or maybe a couple, just to see what interests you the best.
Thank you. Now, I know there was a question in the Q&A that asked what is done in the PA program that is not done in a nursing program?
Oh, that's a great question. We get, so if interestingly, I was actually just speaking with a nurse of mine. She is currently in an NP program, and now I don't, I've never been to an NP program, so I can't directly speak from my experience. So I'll speak from her experience. So she told me that we get, as PAs, we get a lot of clinical time that they don't get. I think they spend a lot of time doing didactic years. For us as PAs, amazingly, right away you're learning how to diagnose and treat even in your didactic year. And once you get to your rotation, you're basically treated like a medical student. So you're trying to spend time with the surgeon or the doctor, so you get to do what they're doing, basically. So I would say that would be the biggest difference. And then the fact that um, PAs get to really work in the OR and they really help train us. And I've not seen that much exposure, unfortunately, for a lot of our NPs that I've seen that PA school provides. Sure, a lot of programs might be different for NPs. I'm only speaking from experience from one NP that I know is in school right now. But it also depends on the program that you're going to. So maybe some NPs may get more or less exposure clinically depending on their program. But that I would say would be one of the biggest differences.
Thank you. Students, I would like to, audience, I would like to open up for questions for Sana. If you could post your question in the Q&A section, that would be great. Sorry, I'm being. I see another question. Give me 1 second, please.
Sure.
Okay. So no, there's no question there. If you'd like to ask another question, please use the chat box. It'll be a lot easier for me. I do have a question for you, Sana. How do you deal with stress? It seems like you are moving quite a bit and your day starts very early. What do you do to distress yourself?
Interestingly, when I started this job, which was a year and 5 months, that was my first job as a PA. And the same time, I actually joined a gym close to my home. And there were classes in the gym. So I honestly look forward every single day to go to my Zumba class.
Mm.
And it's Mondays and Fridays, and then sometimes on Wednesdays. I know in the back of my head, my class starts at 5:45, so I'm gonna do everything it takes. So the reason also I come in earlier is not just because I have procedures in the morning, but I want to get all this work done in the morning, and I want to go de-stressed, and I dance it out in my dancing class. I would say that really incredibly helps me de-stress. So you got to find an activity every single day that you want to look forward to after your hard days. Even if it's, say, tonight for that 1 hour, I'm going to go watch my favorite. You have to find it's something that every single day you have to say, that hour is mine, and I'm going to enjoy and de-stress. Because if you're not doing that every single day, that stress is going to pile up and you'll burn out fairly quickly. And I did not, the first couple, I think, weeks, I didn't go to the gym. I was just trying to figure out what I'm supposed to do as a PA, and I was stressed out. I couldn't even sleep because I knew that next day I'm going to work, and oh my God, I'm going to take care of patients and I'll be responsible for them. And it can stress you out so much that it could keep you up. And it's a vicious cycle because you're not sleeping, you're tired in the morning, and you're working, and then you're going back to sleep, but you're not really sleeping. So I would say find an activity that you really love and that will help you de-stress. I know some people read books to de-stress. Other people read, jog. I love dancing, so I go do basically dance, do my Zumba, and those moves just make me so happy. And I would say during work, you also have to learn how not to take things personally. At first I did, don't get me wrong, it was very hard because, as you know, in surgical field, people are rude to you, not because they want to be rude, because they're stressed. And when people are stressed, they say things they don't mean. So you have to make it a task that just because someone's being rude doesn't mean it's about you. It's about them. They're just deflecting their feelings on you. So now your job is, do I really want to take this person's feelings and absorb it, or do I want to hear it and let it go? That choice is on you. So I told myself before I didn't, but now every single time someone gets pissed off or whatever in the operating room, I laugh out loud. I'm just like, oh, wow, I wish it affected me. It did affect me at first. So those are two things I would say big key. You got to learn, but you can't observe it. If you start to absorb things, know that it's gonna hurt you mentally. And so save yourself that stress and don't absorb, don't respond. Um, because your response is basically half the battle. If you don't respond to it in a very emotional way, you can kind of actually ignore it. And then lastly, I would say another way to keep level of stress low is communication. You want to find out who's giving you that stress or what job is giving you that stress, and then find a way. If this person you're working with, they're stressing you out, then you want to make sure you talk to them. And it's hard to confront people, it is, but you keep confronting people every day of your life. In about 20 days, you'll be so good at confronting people in the most, benign way. But you'll confront them and say, hey, you did this last time and it made me double my work. Could you please, find an additional way? Be stern, but tell people exactly how you feel in the most nicest way, but be stern. Because you're going to be living for the rest of your life and you can't live hiding your feelings. So these are my, I would say, three go-to points that how I keep my stress level, kind of maintain it where I like it.
Those are great tips, Sana. Thank you for sharing that. We do have one question in the chat box, and it
Yes.
says, how can I get my patient contact hours? Should I do CNA, MA, or EMT?
Those are all three great places to go. CNA, EMT, and what was another one?
MA, medical assistant?
Medical assistant. I would say if you were asking me to go on a ascending order, where I would say the best experience would probably be EMT. Um, I I wanted to do that when I was in high school, but my mom pulled me out of it and said, because she's first generation immigrant like me, and we had just came to America, and she was so against me going out there on my own. I said, Mom, I'm gonna be an EMT, but she was afraid that I will meet different kinds of people and I wouldn't know how to deal with them. But long story short, if I had a chance to redo my younger years, I would completely be an EMT. That will be your best experience on how to treat patients in emergent situations. You will get how to resuscitate them, push maybe medications, depending on what your practice allows you. And then finally, kind of helps you prioritize what's number one, number two. And I would say second would be on my list is medical assistant. I was a medical assistant myself, and I was also a CNA. In CNA, I think that you will not be doing a lot of clinical work. You will assess patients at all times, but I think a lot of those skills kind of like pocket you in one small space. But with MA, you're basically asking your chief complaint, why are you here? How can I help you? So you kind of doing comprehensive history and physical, which is what you'll be doing as a PA. So MA is a great experience. I would say EMT is a great experience. Um, Definitely EMT on the top of the list because you're right there assessing, diagnosing, treatment. You're giving them on the spot. And number two would be MA. The other thing that would also be nice is respiratory therapist. Wow, I have two respiratory therapists who are PA students who were in my class. Very, very intelligent. And they work with ventilators every single day. So they already come in with this immense knowledge that most of us didn't. So very good question.
Thank you. I have two more questions that are
Yes.
posed by our attendees. What are some struggles you had in the PA program?
I would say PA program is very competitive. Um, you have to basically learn to prioritize what's important and what you're gonna get tested on next. I my problem is I will everything say I learned four, but you go to 4 classes and I want to learn everything and I want to get really good at everything. Sure, you can do that, but I learned my lesson that I can't just sit around and spend hours on doing one class and say, I'm gonna master this lesson. You have to say, all right, I got an exam in 3 days in this class, I better start working on it today. And then tomorrow I cover something else. But I mean, priority is number one, and I struggled so much with that. And over time, I learned. But if you're a perfectionist, you want to learn everything to down to the base. And sometimes you just need to understand the basics, like the foundations. You don't need to memorize cycles. For example, I know you guys will probably be reading Krebs cycle since God knows, like 8th grade. But when you come to PA school, you don't need that. You know the basis and you understand the physiology, right? But do you actually to memorize a cycle and kind of spit it out? No, you just have to understand the physiology behind it. So that was number one thing. And two is you may not also, it's not necessary, but you may struggle with personal relationships. So going into PA program, you have no time for anyone. The only person you have time for is yourself and school. And if say an hour of your time, if you have some time and you spend it at the gym, which I think you should be going to the gym apart from going to school, is and if you have a husband or a boyfriend or a family and they say, hey, you're not meeting these expectations, you won't, because you don't have time for it. You can't have a job, so that's another thing. If you're supporting your family financially, then it may be a good time to discuss who's gonna next be the financial kind of head of the family, because you can't have a job in PA school. It's very difficult. I'm not saying that people in the past hasn't had any jobs. I know some people, very intelligent, knew how to manage their time, work over the weekends. But I mean, over the weekends, all I did was catch up because you get tons of information during the week. So don't fall behind is another thing. You fall behind, you'll be falling behind for the rest of the semester because you're playing catch up. So don't fall behind. So those were kind of my struggles. The first semester, I would say. The second semester, I already knew my rhythm and I know what I want to do. So you get to know what you want to do, and you kind of practice it and get good at it. But those were my first semester struggles. And then lastly, about faculty, you want to go to a school that will support you. I didn't want to go to a big school where I have 500 students and my teachers don't know my progress. I wanted to go to a small facility, which I did, and I was very, very excited and happy about it. So I think that's one more thing that you have to look before you get into a PA school, and what your choice will be if you want to go to PA school.
Thank you for that, Sana. And
Yep.
we appreciate you taking the time to come and share about the role of the physician assistant, an integral part of the healthcare team. And just want to applaud your efforts and thank you so much for your service as a PA. I know things are crazy in the medical field because there's shortages of many health providers, not just doctors. So thank you. Gracias. And attendees, please now go back to the agenda and join the overview opportunities and learn about the internships and volunteer programs that will be available. So please go ahead and do so. And remember to fill out the event survey for a chance to win a $100 Amazon gift certificate. And tomorrow, please feel free to go back to the Whova app to view the job spotlights you missed today, including the physician assistant, pediatrician, respiratory therapist, community outreach coordinator, and health administrator. All will be available tomorrow. Thank you for your questions and for attending the session. Thank you, Sana.
Thank you so much for having me.
And
thank you everyone for
Bye.
you guys all asked great questions. Thank you. Take care.
Bye.
Bye.